try this the next time you stand up from a chair. Do you rise smoothly without thinking about it? Or do you lean forward, push through both hands, pause for a moment, and wait for your legs to cooperate? That tiny hesitation may seem harmless. You may blame the chair, your knees, or simply getting older. But your legs often reveal declining strength long before you recognize that anything serious is changing. It may begin quietly. You stop taking the stairs because they feel steeper than before. You hold the shopping cart for support. You walk a little more slowly so nobody notices you are struggling. And then, one day, you lose your balance doing something you have done safely for decades. This is not meant to frighten you. It is meant to show you something most people discover too late. Weak legs are not always an unavoidable part of aging. They can be a warning of hidden muscle loss, poor circulation, nerve problems, medication effects, or another condition that deserves attention. Stay until the end, because warning sign number 1 is not simply tired legs. It is the moment many older adults lose confidence, independence, and sometimes the ability to live safely on their own. And after revealing all 9 signs, I will show you the 3 types of movement that matter most for protecting your legs after 60. I'm Dr. Richard, and today we are uncovering 9 warning signs your legs may be weakening faster than they should. Why your legs matter more than you think. Your legs are not merely 2 structures that carry you from one room to another. They are your foundation.
They help you rise from bed, use the bathroom without assistance, climb steps, shop for groceries, visit friends, and remain independent. When leg strength begins disappearing, your entire world can gradually become smaller. You stop walking as far, then you stop going out alone, then you avoid places without elevators. Eventually, activities you once performed automatically begin requiring planning, support, or another person. Age-related muscle decline is known as sarcopenia. Muscle mass can begin declining much earlier in adulthood, and NIH health information estimates an average loss of roughly 3% to 5% per decade beginning around age 30. Over time, excessive loss can reduce strength, limit mobility, make chair rising and walking harder, and increase fall risk. However, this video is not about accepting weakness. It is about noticing the signals while you still have time to respond. Let us begin with a sign that appears in living rooms every day. Warning sign number 9. You push with your hands to stand up. Watch closely the next time you rise from a chair. Do your legs lift you? Or do you place both hands on the armrests, rock forward, and push yourself upward? Using your hands occasionally does not automatically mean something is wrong. A very low sofa, knee arthritis, recent injury, or back pain may change how you stand. But if you once stood easily and now depend on your arms every time, your leg muscles may no longer be producing the same force. Your thighs and hips contain some of the largest and most important muscles in your body. These muscles must work together whenever you rise from a seated position. Imagine an elevator designed to lift 10 people. If its motor gradually loses power, it may still move, but only after hesitation, shaking, or assistance. Your legs can behave similarly. This is why clinicians often include a chair-standing task when evaluating possible sarcopenia or reduced physical performance. Chair rising, walking speed, balance, and grip strength are among the measurements used to assess muscle strength and mobility. Consider a fictional example named Robert. Robert is 71 and believes he is active because he walks from his house to the mailbox every morning. But his daughter notices something else. Whenever he stands after dinner, he presses both palms into the table. He tells her, "My knees are just stiff." Months later, Robert realizes he cannot rise from a low chair without someone pulling his arm. The biggest warning was not pain, it was dependence. If standing has become noticeably harder, do not wait until you can no longer do it safely. And pay attention to what happens immediately afterward, because the next sign often appears in the first few steps. Warning sign number 8. Your walking has become slower. Has someone recently told you to hurry up? Do family members walk several steps ahead, even though you once kept pace easily? Perhaps you take smaller steps, keep your eyes on the floor, or need longer to cross a parking lot. Most people do not notice gradual changes in walking speed because the brain constantly adjusts. You do not wake up one morning walking slowly. Instead, your steps become slightly shorter. You begin leaving home earlier, You choose the nearest parking space. You quietly avoid walking with faster friends. Slower walking can result from arthritis, pain, fear of falling, heart or lung disease, nerve problems, poor circulation, or muscle weakness. But it should not automatically be dismissed. Walking speed is used in clinical assessments because it reflects more than the strength of one muscle. Walking requires coordination between your brain, nerves, heart, lungs, balance system, hips, knees, ankles, and feet. Expert groups include reduced walking speed among important measures of poor physical performance and sarcopenia severity. Here is a useful question. Are you walking slowly because you choose to, or because your body no longer gives you another choice? If you can speed up safely when necessary, that is different from feeling physically unable to increase your pace. But do not test yourself by rushing on an unsafe surface. Instead, notice your normal routine. Are pedestrian crossings becoming stressful? Do you struggle to keep up inside a supermarket? Does walking from one room to another feel more deliberate? Your walking pace can become your body's quiet report card, and the next test appears whenever the ground begins rising. Warning sign number 7. Stairs feel much harder than they used to. There is a reason many people first notice weakness on stairs. Walking on level ground allows you to keep moving forward with relatively small changes in height. Stairs require your muscles to lift almost your entire body against gravity, again and again. Your thighs, hips, calves, and core must cooperate. You may first notice that you always lead with the same leg. Then you begin pulling on the handrail. Then you climb one step at a time, bringing both feet together before attempting the next step. Eventually, you stop using the stairs entirely. The handrail is an important safety tool, and there is nothing wrong with using it. The warning is a clear decline from your previous ability. Imagine Margaret, age 68. For years, Margaret carried laundry from the ground floor to her bedroom without thinking about it. Recently, she began leaving the basket at the bottom of the stairs and carrying only a few items at a time. She never described herself as weak. She simply changed her environment to hide the weakness. That is what many people do. We compensate so effectively that we do not recognize the problem until our world has already changed around it. Difficulty climbing stairs is included in simple sarcopenia screening questionnaires because it can reflect declining strength and function. Strengthening exercises can improve the physical ability needed for daily tasks such as climbing stairs, rising from a chair, and carrying groceries. But what if your legs still function and simply look different? That brings us to warning sign number 6. Warning sign number 6. Your thighs or calves are becoming smaller. Look at an older photograph of yourself. Not your face. Look at your legs. Do your thighs appear noticeably thinner today? Have your trousers become loose around the legs even though your waist has not changed? Does one calf appear smaller than the other? Muscle loss can be difficult to see because it often occurs slowly. Body fat or loose clothing may also hide changes in muscle size. The scale can be misleading. A person may weigh exactly the same while losing muscle and gaining fat. That means stable body weight does not always equal stable strength. However, visible shrinking should not be self-diagnosed as sarcopenia. Reduced muscle size can have several causes, including inactivity, nerve injury, joint pain, illness, poor nutrition, or reduced blood supply. A clear difference between the two legs deserves particular attention. For example, if one calf is becoming smaller, colder, paler, or more painful than the other, circulation or nerve function may need evaluation. Peripheral artery disease, or PAD, reduces blood flow to the legs. The American Heart Association lists calf muscle loss, temperature differences, slow healing wounds, reduced hair growth, and skin color changes among possible signs. Here is the important distinction. General muscle loss may make both legs gradually weaker. A local circulation or nerve problem may affect one side more than the other. Do not panic when you notice a difference, but do not ignore a change that continues progressing, because sometimes the next warning does not appear in the mirror. It appears halfway through an ordinary walk. Warning sign number 5. Your legs become heavy after short activity. You begin walking normally. Then, after a few minutes, your legs feel heavy. Your thighs seem drained. Your calves tighten. You search for somewhere to sit. A brief rest helps, But when you begin walking again, the feeling returns. Several different problems can cause this pattern. Muscle deconditioning is one possibility. When muscles are not regularly challenged, they lose endurance. A distance that once felt easy begins feeling demanding. But another possibility is poor circulation. Peripheral artery disease occurs when arteries carrying blood to the legs become narrowed or blocked. Its most common symptom is aching, cramping, burning, fatigue, or discomfort in the hips, thighs, calves, or ankles during walking or climbing stairs. The discomfort often improves after stopping and resting, then returns with activity. This is one reason the phrase, "my legs are just getting old," can be dangerous. The discomfort may not be coming from age alone. Ask yourself, does the pain begin after a predictable amount of walking? Does it improve after several minutes of rest? Does it return when you start again? That pattern deserves a conversation with a healthcare professional, particularly if you smoke or have diabetes, high cholesterol, high blood pressure, or cardiovascular disease. Do not begin an intense exercise program until unexplained leg pain has been assessed. The goal is not to push through every warning. The goal is to understand what the warning means. And now we reach the point where muscle weakness begins affecting something even more important than walking: your balance. So far, we have discussed difficulty standing, slower walking, struggling on stairs, shrinking muscles, and heavy legs. But the final 4 signs are more serious because they can signal that weakness is beginning to threaten your safety. Before we continue, answer this honestly. During the past year, have you nearly fallen, even if you caught yourself? Most people remember actual falls. They forget the moments when a wall, countertop, or piece of furniture saved them. Those near falls matter, and they lead directly to warning sign number 4. Warning sign number 4. You reach for furniture while walking. You stand up and immediately touch the table. You walk down the hallway with your fingertips against the wall. You move through the bedroom using the dresser, chair, and bed like stepping stones. This is sometimes called furniture walking. It can become such an automatic habit that neither you nor your family notices it. But your hands may be doing the work your legs and balance system can no longer perform confidently. Balance depends on several systems working together: your vision, your inner ear, sensation in your feet, your brain, your joints, and your muscles. If any part of that system becomes less reliable, your body searches for additional support. That support may be the wall. Consider an illustrative viewer named Helen. Helen insists she does not have a balance problem because she has never fallen. But when her grandson watches her walk from the kitchen to the living room, she touches 5 different surfaces. The absence of a fall does not mean the absence of risk. It may mean the furniture has been catching her. More than 1 in 4 adults aged 65 and older experiences a fall each year, and falls are not considered an inevitable result of aging. Prevention strategies can reduce risk. If you regularly need furniture for support, tell your healthcare provider. A proper review may include balance, vision, footwear, blood pressure, medications, strength, and home hazards. Do not hide near falls because you fear losing independence. Reporting them may be exactly what helps you preserve it. Warning sign number 3. You avoid getting down on the floor. When was the last time you sat on the floor? More importantly, could you get back up? You may avoid the floor because of painful knees, hip replacements, back problems, or simply because you have no reason to sit there. But some older adults avoid it because they quietly fear becoming trapped. Getting up from the floor demands leg strength, hip mobility, balance, coordination, and confidence. A person may still walk reasonably well, yet lack the strength to recover from a low position. This becomes important after a fall. The injury itself may be minor, but the inability to rise can create a dangerous situation, especially when someone lives alone. Do not attempt a floor rise test without support nearby. You do not need to prove anything by putting yourself at risk. Instead, ask yourself whether you have gradually stopped. Playing with grandchildren on the floor, gardening at ground level, reaching low cabinets, kneeling during household tasks. Sometimes avoidance is the first visible sign of lost function. This is also why strength training should not focus only on appearance. The real goal is usable strength, the ability to lift your own body safely during everyday life. Yet, warning sign number 2 requires a different kind of urgency, because not all leg weakness develops slowly. Warning sign number 2. One leg suddenly feels weak or drags. Age-related muscle loss usually develops gradually. Sudden weakness is different. If one leg suddenly becomes weak, numb, difficult to control, or begins dragging, especially with facial drooping, arm weakness, trouble speaking, confusion, vision changes, dizziness, or severe loss of balance, treat it as an emergency. Those can be warning signs of a stroke. The CDC advises calling emergency services immediately for sudden numbness or weakness affecting the face, arm, or leg, particularly on one side, as well as sudden difficulty walking, speaking, seeing, or maintaining balance. Do not wait to see whether it improves. Do not drive yourself. Do not assume you slept in the wrong position. Every minute matters during a possible stroke. There is another pattern that may develop more gradually. The toes begin catching the floor. One shoe wears differently, or the foot slaps down while walking. This can have several causes involving nerves, muscles, the spine, or the brain. It deserves medical assessment rather than being blamed automatically on aging. The central lesson is simple. Slow decline needs evaluation. Sudden decline needs urgent action. And now we reach warning sign number 1. It is the sign that often changes how a person sees their own future. Warning sign number 1. You fall or cannot get back up. A fall is not merely an accident. It may be your body's final message after months or years of smaller warnings. The chair became harder. Your walking slowed. The stairs became exhausting. You touched the wall for balance. You nearly fell several times. Then one day, your foot catches a rug, your knee gives way, or you turn too quickly. Afterward, many people become afraid. They stop walking outdoors. They avoid bathing alone. They decline invitations. They move less because they fear another fall. But less movement can lead to further loss of strength, which may increase the risk even more. That creates a dangerous cycle. Weakness leads to fear. Fear leads to inactivity. Inactivity creates more weakness. The solution is not reckless confidence. It is proper assessment followed by safe, progressive movement. A healthcare professional may evaluate your walking, balance, chair rise ability, medications, vision, blood pressure, feet, joint health, and home environment. Clinicians may also use gait speed tests, chair stands, grip strength, or body composition assessments when sarcopenia is suspected. A positive screening result should lead to further evaluation rather than self-diagnosis. If you have fallen, tell your healthcare provider, even if you were not injured. Do not hide it because you are embarrassed. A fall is information, and information allows action. What you can do starting now. The encouraging news is that muscle and physical function can respond to activity at almost any age. You do not need to train like an athlete. You need to give your body safe, consistent reasons to remain strong. The National Institute on Aging emphasizes 3 important categories for older adults: aerobic activity, muscle strengthening, and balance exercise. Current guidance generally recommends working toward approximately 150 minutes of moderate aerobic activity per week, muscle strengthening activity on at least 2 days, and regular balance work, depending on individual ability and medical advice. First, strength training. This may include supervised chair rises, resistance bands, supported squats, step-ups, or appropriately selected weights. The key word is progressive. Your muscles need gradual challenge, not sudden punishment. If you are frail, unsteady, in pain, or have a major medical condition, begin with guidance from a doctor, physiotherapist, or qualified exercise professional. Second, walking or other aerobic movement. Walking supports endurance and circulation, but walking alone may not fully replace resistance training. Start with a duration you can complete safely. Consistency matters more than speed. If walking causes predictable calf pain that disappears with rest, seek medical advice because circulation should be considered. Third, balance practice. Balance exercises may include supported single-leg standing, heel-to-toe walking,
Tai Chi, or structured fall prevention programs.
Always use stable support and avoid practicing alone if you are at high risk of falling. Fourth, support your muscles with nutrition. Muscles need adequate energy and protein, but the correct amount varies with body size, activity, kidney function, appetite, and medical conditions. Do not begin high-dose protein supplements simply because a video tells you to, particularly if you have kidney disease or another condition requiring dietary restrictions. Ask your healthcare provider or dietitian what is appropriate for you. Fifth, investigate the cause. Weak legs are a symptom, not a final diagnosis. Possible contributors include inactivity, sarcopenia, anemia, thyroid problems, vitamin deficiencies, medication side effects, nerve damage, arthritis, circulation disease, heart or lung conditions, and other illnesses. The most useful question is not, "Am I getting old?" It is, "What is causing this change, and what can I safely do about it?" Your legs do not usually fail overnight. They whisper first. A little help from your hands when standing. A slower walk through the supermarket. A handrail that becomes essential. A near fall you never mention. A chair you stop using because it is too low. These moments may look small, but together, they tell a story. The goal of this video is not to convince you that every tired leg means disease. It is to stop you from dismissing every change as normal aging. Because aging is real, but so are treatable medical conditions, preventable falls, and strength that can often be improved. Your legs carry more than your body. They carry your freedom, your confidence, your ability to leave the house, visit family, and decide how you want to live. So pay attention when they begin asking for help. Speak with your healthcare provider. Begin moving safely. Build strength gradually. And remember, it is not too late simply because you are over 60.
If this video helped you recognize a warning sign, write, "I'm protecting my legs" in the comments. And tell me which sign surprised you most. Like this video, share it with someone who has recently complained about weak legs, and subscribe for more doctor-led guidance on staying strong, mobile, and independent after 60. Thank you for watching. Take care of your legs because they are carrying the life you still want to live. This video is for general education only and does not provide individual medical diagnosis or treatment. Weakness, pain, balance problems, and falls can have many causes. Consult a qualified healthcare professional for persistent or worsening symptoms. Seek emergency help for sudden one-sided weakness, facial drooping, speech difficulty, severe breathing problems, chest pain, or another sudden neurological change.